Ah, okay. Thank you very much. Okay. Hello, everybody. My name is Alena Plieninger, and I work a little bit else. I work against all these or most recommendations here. I will wait till you take place. So, okay. And I work with. So sorry. I work with this technique of magic gloves. I work with wet gloves and with vinyl gloves. So how I told you, it's a little bit else, and it's against recommendations. Okay. I come from neuroanatomy in Switzerland, and I have worked 6 years at the Anatomical Institute. So I'm more fixed in anatomy. And so therefore, I thought I want to treat muscles and conductive tissues. Should I, this one?
No.
What is this?
Arrows.
Aha, okay, thank you very much. I come from the school from Sasha-Ravenko, but I'm very happy that I have also seen another school like yours. So you can then have this presentation so you can read it yourself at your PC. Okay? So I will make a little bit quicker. The advantages of this technique is that you use this impulse, even if it was said, oh, that's not so much the impulse if it's wet and if it's made with this conductive tissue. Sorry, but it works. And what's great, I can manipulate also the muscles. And because I come from this neuroanatomy, I see the problem a little bit from another side. If you have a problem and it is chronic or new, your brain will also somewhere fix it. And even if the pain is away, it is there. And if something will happen, it makes, my leg, oh God. Yeah? So that's the problem. From that side, I look at it. And I'm very happy that Mr. Prince told you something against, and Josif Semikatov, because I work a little bit like that. So, with this technique, I can use my hands, and that was the most important thing for me. I don't want to only make something like that, but I want to feel what will happen. I will feel how the muscles are, how the persons move, what because I take this possibility. Oh, sorry, that's a part in German, but I have translated it, okay, too. So it must be somewhere else. So advantages for the patients is that it's very funny, mostly, not always, but the most patients like it. They like this impulse of the SCENAR, and they like that I touch them. Yeah, it's easy, and what's also very important, it's for the therapist, not really hard. You can really work, you can move, you can make it like a dance with the patient, and you have not always that, and somewhere you have the problem with the canalis carpi, because you can't try it so long, okay? Because in the big time before, with Sasha Ravenko, sometimes you have treated somebody for 10, 15 minutes, and that was really horrible for me. So, the treatment is nearly pain-free. The position for the patient and the therapist is very comfortable normally. Most patients enjoy the treatment and tell you afterwards, hey, that's great, I feel like newborn or reborn. And you must know, I created naturally this technique on myself because I have had pain in the back from working like that, making this 3 lines and 6 points. And I thought, God, no, hey, that's so painful. And then when I found it, you can also treat yourself with this method. And that's the big thing, isn't it? So it needs about 45 minutes if you are working well for the patient that he has nearly all done. And you have very fast success. And what's also very interesting that the patients feel afterwards very fine. They are more communicative, they are friendlier, and because you are not, if you make, for example, fascia and you want to make them free, it's very painful. So the patients are not very glad, okay? And with this method, it's okay, they like it. And they say, oh, hey, I can move now, and it doesn't hurt me, so it's okay. Oops, sorry. So, you can use nearly everything if you, when you treat this soft tissue, this is muscles, connective tissues, and so on, because it works. And you must try it. So then you can say it's something for me or it's nothing for me, okay? It's because when you work this method, you have naturally absolute liberty, okay? And that's sometimes a problem for a lot of people because some therapists want after one point after the other to treat. Here, I tell you and I show you a first treatment, and then you can treat after your opinion. Because as therapists, you have also this liberty to choose, okay? You speak with the patient and he gives you, oh, it's great here, but my knee. And then you work on the knee or somewhere else, yes? What's very important that you know that if you treat with SCENAR, equally how you will treat, you have to make a detoxification, yeah? Because you make the body dissolved, the toxins comes out. And if you don't help to the body to come really out, it rests inside and it works, okay? What's also important, and was Jörg Prince told us, that the lactate, I measure always lactate because I work also with oxygen therapy. And it was funny when I measured the lactate before the treatment and after the treatment, we have really change, okay? The lactate comes down, even without any oxygen. Yeah, I like to treat the people and then I tell them, okay, go for a half an hour to treatment with the oxygen therapy after Ardenne, and then they feel great. But sometimes I think it's not necessary because the system works really very well. And for me, and this is really the truth, if I work at my practice, I work every day with the SCENAR. And perhaps one person per month, I make a massage, how they want, if they want only a massage, okay? And if not, I work only with the SCENAR. And like Josef Semikatov told us, I tell them people, hey, if you don't have any problem, you make a call and it's okay. You have not to come. And I can tell you I work normally from 8 till 7 or from 8 till 9, okay? But I enjoy it, so I have no problems normally. Sometimes, yes, if you have a patient with 120 kilos, then I must really say it's heavy, okay? Then you have problems also because you have to work. But normally not. Normally it's really very, very funny, and you can, because of the SCENAR and of the endorphins, patients are very friendly and very well, yeah, they are happy and say, yeah, last time it was so great, you know. And yeah, naturally you can also have patients who tell you, oh, and you, what's the matter? What's the matter? It's too much. No, continue. And you after, oh. And if somebody will hear it, he will think, hey, what do they do there? Okay, so what you need is the SCENAR device, even absolutely simple. A SCENAR home you can use, it's not a problem. If you can buy naturally a good one with one head, it's naturally great. Winter gloves, these electroconductive gloves, and they must be wet. Okay? A cable, your hands, your sensitivity, and a little bit knowledge of anatomy. Okay? But I think the most of you have. Good comprehension, because you have to hear to your patient, and you have to use your eyes, you have to use your senses, because that's important, and this is what gives you the liberty, okay? And a patient and you. So, pain can be somewhere else where the problem is. That's my experience. I have had such a lot of people, and they told me, yeah, I have pain here, and the problem was latissimus dorsi. Yeah, naturally it is also here, but yeah, the problem was somewhere absolutely else. So that you can read at home. What's also very fine, that you can use muscle trains if you know them. You can use the meridians if you know them. But you don't, it's not necessary to know something like that. You can also use only your sense. Yeah? Oh, have a look. How is this patient walking? How does he react? How does he sit? That I will show in the practical when we have this hands-on. Okay? Oops. And this is the problem. If you have any, yeah, this is in German, okay, but not a problem. You see it. If you have any problems of muscle, that the muscle is too much, have too big tension. For example, if you have, it was, I think, yesterday when Irina told us about this people who goes to train their body. And in Switzerland, we tell it, these are the from, yeah, not Swiss, but outside of Switzerland, yeah, and they come like that. And then you tell them, oh, you have, no. And then you treat them, oh, that's great. But I have still my muscles? Yeah, you have still your muscles, that's clear. But yeah, you don't walk like a machine, like mastodon. Okay? Anamnesis. That's very important, anamnesis. You have to look at your client. You have, I have a lot of young, or not young, people from the school and therapist school, and I say to them, hey, have a look how the patient is sitting. You see something? What? That's it. I said, yeah, but do you see the hip is not on the same line? No. Why? Have a look. Oh, okay. So the most people from the schools are not used to use their eyes and the senses, even the doctors. And this is a shocking thing for me, because I was 6 years at the Anatomy Institute, and I was as assistants. So we learn to the doctors, to the future doctors, how they have to use their senses. And then you see that they don't use it. They want only build-in the diagnostic. I don't know what's the name in English. Jörg, can you help me?
X-rays, CT scans.
Yeah,
like that.
and they say, yeah, we didn't see anything. I told them, yeah, you don't see anything, the pain is there. Perhaps he seems to be there. I said, oh yeah, okay, great. And the patient has to pay for that diagnosis, for the story. Yeah? My parents came from the industry. I come from Basel. So in Basel, there is the most industry, the Hoffmann La Roche, Novartis, and so on. And if you look how they make their studies, you can only laugh about it, okay? So I don't believe if I don't try myself. So, sorry, I'm very clear. So I want to show you at the, then in the presentation the problems with the joint of the sacral area. For me, it's one of the most important things. The name is also sacral, so it is also sacrum, okay? It brings something. If you treat only that, the most patients with neck problems will say, wow, I feel now much better, and I can turn my head. So, the SCENAR settings are very easy, what I need. I need only RM, 1-to-1. You can use also 1-to-2, 1-to-3, but not more. Well, I would say not more. Frequency modulation, how you need, I use it. If it's chronical, I go down. If it's not chronical, and I ask always the patient, do you like it? And if you don't like it, I change. You can use the SCENAR Home. And how I told you, you can always speak to the patient and ask him, do you agree? Is it okay? Not? The setting is I start on the sacrum and goes up. And then I go to the hip. And then I ask the patient to sit on my hands. That's funny. But it's very productive because then the patient is sitting on your hands and you feel very well the biceps femoris. You feel the whole construction of this part, okay? And then you feel if the patient is not okay or if it's okay, and so on, okay? Bones doesn't dance, only if it's animated. Bones and joints can't move without injury or an accident or without muscles. So forget if somebody tells you, oh, your vertebra is going out. Hello, I'm going out. No, not possible. The important, this is this very important thing, the feedback from the patient. Yeah. So, yeah, and have fun with this technique. Try it. If you like it, great. If you don't like it, it's okay. Thank you very much.
Да, хорошо. Уважаемые коллеги, тут, когда был перевод, была некоторая неточность. Когда говорили о сакруме, это не шея. Вот. И еще хочу сказать, что вот эти методики при болях в спине, они универсальны. Вот. И очень много может быть подходов в лечении. Вот. В АКБ-ритме очень много работ по лечению боли в спине. А с другой стороны, прежде чем дать слово следующему докладчику, хочу сказать, вы видите, как полезно знать анатомию, физиологию, биохимию и все, что связано с медициной. Поэтому, как
В общем, наверное, вы это знаете и знаете, что это заболевание считается неизлечимым во всем мире.
It's the multiple sclerosis of Schwann cell membranes. It is very destructive to both brain and spinal cord, and it also involves peripheral neural system. And all the symptoms and syndromes are based on the variability of nerve destruction. I will skip the preamble and go directly to the story. Here's the patient. He came to our clinic. And his complaints we just need to navigate to why we decided to speak about this patient at this conference. His major complaints was headache. This was his very acute and very sharp headache, as well as abdominal pain, which was also accompanied with the inability to control the process of defecation, which incredibly worsened life quality. His secondary complaints were about visual problems, weaknesses, and numbness in the left arm and leg. He also had a sexual disorder and suffered from loss of coordination, due to which he would often fall down if there was no support nearby. He also had painful cramps in the muscles of the legs while strong tensions. He was unable to do any physical tension. He felt incredible pain now when he had to lie down on the couch. He had been previously treated in many hospitals, including one medical institute in Tomsk, and different medicines and methods, including hormonal, with no effect. But the side effect of that therapy was 25 kilos overweight, and this again incredibly worsened the quality of his life. Objectively, he was overweight. Objectively, we could observe overweight, pasty skin, poorly coordinated movements, painful cramps in the leg muscles. He had great difficulty pronouncing fricative sounds. There was sporadic change of themes. He was just jumping from one subject to another. He couldn't concentrate his attention. Abdominal palpation was painful to varying degrees, but it was always painful, and sometimes it was just impossible to touch his belly. His left hand was hydropic, and handshake force was reduced by 70% as compared with the right hand. Tomography results are on the slide, but they prove that he was indeed suffering from multiple sclerosis, and so the diagnosis was right. You can believe me. Here's the patient. His name is Vadim. We'll demonstrate a video. You'll be able to see the way he spoke and moved at the initial stage of his treatment in our clinic. Well, I guess you couldn't hear it very well, but anyway, it is clear that his speech was pretty distorted, and he complained about memory losses. He was unable to learn and memorize new things. We reasoned that if multiple sclerosis is the result of an autoimmune processes, then theoretically the process can be stopped, just as we stop it in the treatment of asthma or autoimmune thyroiditis, and so on. The first thing we had to deal with was headache. We had to eliminate it because he was pretty exhausted with that. We used the process as the state management information system. The technique is based on the analysis and processing of test points. We analyzed each of the points shown here on the slide. We palpated the most acute points which had the most clear connection with headaches. We built the hierarchy or the comparative row of these points, of which we had to choose the points that had the most immediate treatment. I will speak about it in detail at the seminar in the following days. At the first treatment session, his headache decreased by 60%. After the second session of treatment, the pain was completely gone, but there still was heaviness in the head. This heaviness disappeared after the fifth session. At the same time, the patient's orientation improved and his ataxia reduced. He started to walk independently. In parallel with the first problem, we were solving the second one, the elimination of abdominal pains and restoring of defecation control. Solving the second problem helped us to solve the first one, as these areas are reciprocal to each other. We treated with the DO and R1 modes. We used crosses and nails techniques. We also used external electrodes, and we also used the sandwich electrodes in the abdomen and sacrum areas. Sorry, it's a bit of we used the electrodes called the snake of conic. These are magnetic balls made from rare earth elements and coated with silver. They can easily be connected to strings of any length. They are very effective because they can take practically any shape. So we can stimulate quite sophisticated areas. They are easily compatible with a scanner device. So they commute with the scanner very easily and prove to be very effective. On the fingers, it's a great way of treating polyarthritis because scanner stimulation is just impossible at these areas which are not quite easy to reach. These electrodes, on the contrary, show great results, and it proves to be very pleasant for the patient because they enjoy it greatly. And this is the way we treated the mentioned patient. We made this sort of fir tree all along his spine. So as you can see, the stem was on the spine, and the branches followed the sympathetic knots. The leaves at the end of each branch correspond to the knots under the skin. We located the adaptation and protection centers in the spine. These centers are responsible to the organism adaptation to any situation, including quite serious diseases. So we suppose that this area must be very effective if we treat it with a scanner for this disease. I have a couple of these electrode sets. I can show you them, and this is the way we use the sandwich electrodes. The electrodes are produced in Tomsk, and we use it to treat quite different diseases. And in this particular case, we observed that while palpating this pain, we could see that it was reflected in the back. Let's see a video. We were not surprised by this connection of the pain in the abdomen and spine. Later. Okay, this video will come later. We put one electrode under the back, right, following the spine, and the other electrode was on the pain projection on the stomach, and we got a very positive result. After the third session, abdominal pains began to change. They went down into the area below the navel, and diarrhea followed. This stopped 2 days later. For 2 days, he was actually unable to leave the toilet room. So we estimated it as a positive result because this cleared his organism, and this was the change dynamics. After the 10th and 11th sessions, the bowel activity control began to form, which made the patient happy. He was as happy as could be because he finally could walk. He could go for a walk in the street. After the 13th session, the false urges to defecate disappeared altogether. This led to a great improvement in the quality of his life. The patient got a chance to go to walks, and he started to smile more and often and began to laugh at the jokes, and he even told me a few anecdotes. At the same time, we did not lose sight of the main strategic goal. We needed to change the program of action of the nervous and the immune systems. To this end, we applied lingual electrode designed and manufactured by us 3 years before. It is made of dental plastic, and we decided to use it because we found a very unexpected proof of its effectiveness. We find the information from the United States that one of their laboratories has proved the effectiveness of electrical stimulation of the tongue. They were able to get very considerable improvements in the conditions accompanying multiple sclerosis and Alzheimer's disease. In their opinion, TAM receptors are directly connected to the brain stem, and they called it the gateway to the brain. We don't object, and we are inclined to believe this. Looks very like the gateway to the brain. Unfortunately, I can't show how we actually applied this electrode on his tongue because this video doesn't work. But please believe me, he sat quietly with the electrode on his tongue and he gestured to us whether we should enhance or decrease the current. After the 17th session, the patient's condition improved markedly. Pains in the head and abdomen disappeared. His coordination and he was able finally to walk independently, and he was able to raise to the 5th floor, and he was able to stand in the Romberg stance up to 15 seconds. His speech became absolutely adequate with good articulation. He got full control over defecation. His sexual function was restored, and quoting the patient, he said that his girlfriend was satisfied. It is only possible to understand his feelings if you are able to put yourself in his shoes. And this is the way he speaks after the first course of treatment, which took 17 treatment sessions. As you can see, he is just overwhelmed with feelings. He says that he's just overwhelmed and he wants to pick up everything that falls down to the floor. And he says that he wants to live and he feels the incredible will to live. Thank you very much for your attention. Thank you once again. I would also like to dwell a little bit upon this problem. The myelinization and the accompanying processes is very interesting. There is a medicine called cortical. It suffers a lot with oxidation processes. SCENAR therapy protects the processes, protective processes in our organism, so we can expect this effect. I think it was very important that was said today that, you know, proof-based medicine always needs something to start with. Indeed, to prove something, we need a good start. Okay, so pioneers. The next report will be done.
Report is made by Yury Perfiliev. He is a pediatrician who works at university. Good evening, dear friends, dear ladies and gentlemen. Everybody likes this scanner technology so much, and nobody wants to go, and it is very pleasant. It is not in vain that Professor Tarakanov, who was the second reporter, and after his first report, he placed the report on the degrees of proof evidence. It could seem to somebody that it doesn't belong to our topic, but in order to reach implementation and such results, as Constantin Nikitin has said, through the state medicine, in order that as many people as possible could get this treatment, we really need as many homogeneous patients. We need multi-center research on homogeneous patients in order that we could really move on to proof evidence level B. Today I would like to tell you about the efficiency of scanner therapy on homogeneous patients. Children who had fractures in the long bones. The analysis of health state of people in the Russian Federation tells us that this problem with traumas is very acute. It is a very important social problem because it influences the state health of all groups of the population. Lately, during the last years, there is some steadiness in the level of traumas between children and adults population. However, among children and teenagers, about 15, 18 years old, the growing of traumas keeps growing. The problem is, traumas appear in the structure of causes of death and invalidization, of getting crippled. It occupies a leading place in teenage period. 15, 18 years old, they're actually healthy children, generally. But what we see are the losses of life, losses of health. First of all, they are caused by different situations which cause traumas, especially road accidents. The thing is that the severity of trauma is growing year by year because we get new high energy damages. Some time ago, a person could be run over by a horse, but this trauma is not so severe. But nowadays, cars have high speeds, about 2 kilometers per hour. They can be in a crowd of bike riders, and such traumas are much more severe, and it is very difficult, much more difficult to treat them. Of course, model traumatological aid is impossible without the use of modern developments of Russian scientists, which is of course pleasant for us, and the practice includes lately also the methods of SCENAR therapy. The problem is that as a rule in state institutions it can be used only with the help of good attitude of a scientist, of good relations between a scientist and the chief doctor. But it is not recorded in the protocol as it should have been. But thanks to our two most delicate colleagues, Mikhail and his team and Yury, who are spreading this technology. SCENAR therapy is already used in many countries for very many different situations. So, our department works on the basis of the Rostov State City Hospital, multi-profile hospital, and in this hospital they have a big department of traumatology and orthopedics. It is the biggest in the North Caucasus, but you can see that during the year there are about 2,000 children with different traumas. For example, including 160, 180 children with long bones fractures. For example, you can see the fracture of the shoulder bone. It is displaced fracture, and you can see that this fracture is accompanied with a very strong pain, up to pain shock. Of course, the first contact which happens with the patient and a paramedic at this moment, some drugs are injected in order to reduce pain, because otherwise we may not avoid some hard disorders which can lead to a very sad consequence. That is why, until now, analgesics were injected first of all. Especially that traumas can happen at night when there is no other physician who has SCENAR device. And the doctor's assistant or paramedics who is on duty at the ambulance department, first of all, injects some medicines. We know from the experience that in any case in pediatry, even after the fracture has been produced, for about 5-6 days, children ask to prescribe them some analgesic medicines. Besides, we understand very well that if we could reduce number of medicines, amount of medicines, that it could solve not only psychological problems, because it hurts to make an injection, but we understand that analgesic injected have a number of side effects to very different systems, gastroenterological, neurological system. And if you manage to reduce the amount of medicines, the treatment will be not only for trauma, we will also keep safer health for the future. And under our observation, there were 43 children, from 4 to 17 of age. It's quite logical that most of them were young people. There were boys and girls. We divided them into two groups. In the first group, there were 22 people who were stimulated with SCENAR therapy. In the second group, there were 21 people, consisting of boys and girls. As the result of pain-relieving therapy, we needed 1/3 less of analgesics, and injection of the medicines was reduced by 3.8 days. But those who didn't get SCENAR therapy, they needed about 6 days of analgesic medicines. It can seem not too much, but for one person, maybe it is not so much. But for thousands of children who stay at our hospital for treatment of different traumas, it is also a big economical issue. And you do understand that children overcome pain in a more difficult way than adults. If we compare with the adults, we can say that the difference is bigger. A child always asks to relieve his pain, to get a pill or injection against pain. For example, you can see this patient. He has subcutaneous fracture of the left shoulder bone. After the replacement and after the operation, we can see that we could work at the pain zone. There was D1 used because we could not move the device and the pain was very strong. We had to make short placements. And in this situation, we work at the symmetric extremity and on the reciprocal zone. This is another patient. It was a girl of 12. She had subcutaneous fracture of the hip bone. Thigh bone. At the beginning, we worked on the damaged leg, but later plaster cast was implied. That is why we worked on symmetry zone and reciprocal zone. It was the other side, not painful, for about 4 or 5 days. And we worked, and there was no pain syndrome after that. This patient had no plaster cast. The girl could sit down or sit up, and we worked with the general zones and the place of fracture and the symmetric zone. We worked for about 3 days with this girl. In this case, this is the photo of a patient with the pertussis disease. It is a genetic disease. It is a bacterial hypertrophic of the head of the hip bone. It is genetically caused, but there should always be some factor which provokes any disease. In this situation, this child had an influenza, which seems to be not a very serious disease, but this genetic aptitude to this disease caused that first the child was limping. They thought it was a rheumatoid arthritis, but then found the correct diagnosis. In such situations, as a rule, the bone begins to get straighter. Doctors break it and make the correct angle, which should be. And you can see that metal synthesis is made and imposed on for a long period plaster cast. Here we worked on symmetric extremity and on the shoulder. For about 5 days, we had SCENAR therapy. It was pain relieving. And during our last congress, I told about our results in orthopedical department that when we use SCENAR therapy, up to 25% regeneration of the bones becomes better. And the appearance of correct bone state appears about 25% earlier, and the patient can be released from the hospital. Here, we made SCENAR therapy not with the purpose of pain releasing, but in order to make faster the regeneration of the tissue, in order for us to remove the plaster cast earlier and to let the child be active and to walk. This is another case. It's a compressional, unsteady fracture of the 6th chest vertebra. We are physicians who made this operation. Here we did not apply the plaster cast. We worked by replacements just on the scar after the operation. Besides, of course, we worked with other zones, but I should say that here the pain syndrome was processed for about 4 or 5 days, and then we continued working to make the regeneration faster, to restore the bone tissue. Here is work on the face, and what can I say in the conclusion? The research we have made to study the efficiency of SCENAR therapy on the group of children with long bone fractures has shown that the use of pain-releasing methods allows to reduce intensity of pain and to reduce the period of pain. It prompted less intensive use of analgesic medicines, and also the use of plaster cast was shorter, and the patient had to stay in bed a shorter time. SCENAR therapy fosters also faster regeneration of the bone tissue. So these are the practical results we have received, and showed another time how useful it is to use SCENAR therapy in the total complex of treatment during the bone fractures, like in this case. I wish you all to be healthy. Thank you. Thank you for the report. Did you see the device which was used to treat the patient? It is 97.4. These devices are 14, 15 years old, but they do work. I have 2 of them still working. And it only shows once again how reliable our devices are. And we go on our conference. If you still have physical strength, we will have a wonderful woman to speak now. Galina Semyonova.
Свои достижения в комплексном лечении различных заболеваний.
I will start with where I was before I met SCENAR. Before I met SCENAR, I was a little bit. I thought I was loud. All right. Before I met SCENAR, I was already a nurse practitioner. I already was another conscience. My first SCENAR teacher was the Yury Perfiliev. And my first patient was my mom. My mom had right side paralysis after stroke, paralysis, and she couldn't speak. It was day number 5 of the heaven where I met Galina. And I said, I have no idea what to do, but I heard that you are a miracle worker, so help me to do something with my mom. And she said, okay, I will teach you to do something, you will go to the hospital and do it. And that's how I was doing. Every day I was going to Meridian, to the hospital, and treating my mom. She started to speak 5 days after I started to work with her. And in 21 days from the start of her stroke, she was walking home by herself. In Russia, there are no where you will go out of the hospital. So she was walking with a walker, but by herself. And she was the first one, who I also started to use SCENAR therapy together with acupuncture idea. Because when I just started to work on her before SCENAR, I knew that I have to put needles in her scalp there. because
Я прогнал.
it
Ну
is
да,
close
ты не
to
переключил.
analysis.
На всякий случай.
So when I got
Переключил,
scanner
вообще
again,
выключил. Почему он меня
I
не
already knew that I can use scanner instead of needle because my mom hated that. And she couldn't speak yet, but she already made eyes for me to know not to come close to me with the needle because the scalp therapy, needles are like that. You have to slide it
Нет?
under the skin of the
Сейчас
scalp.
я перегрузил.
So now, question: who of you know acupuncture or use it? Okay, so now I know the depth of my presentation. And other people will find it very useful too. You need to learn little by little. I won't be able to teach you all CM strategies even within the time of the Professor Tarakanova workshop. But maybe I will
Тут не
just
надо
put
смыкать,
in
не надо.
interest
Пока не надо.
in your physical minds, and you will start using it. So the rationale under the treatments is that the pain from Oriental or TCM Chinese traditional Chinese medicine perspective is caused by imbalance of energy and blood flow affecting the tendinomuscular channels, or sometimes we call meridians, and there is stagnation of blood and energy, and it's like a traffic jam. When you look at the traffic jam, there is cars on one side, lots of them, emptiness on the other side of the accident. And we need to break this obstruction with SCENAR therapy in the meridian to make the patient to have relief from the pain. Right, so SCENAR therapy is used to clear meridian stagnation because it clears everything below the skin. When it touches the skin, the signal goes and makes the balance of the energy in the nervous tissue, and so also Chinese energy. Chinese traditional medicine or meridian therapy also balancing the meridians. It's like the rice fields which have water in the canals, and some canals are not flowing right, so you have to go and dig in so the water can go through. That's what we do in Chinese medicine. And kinesiotaping allows better energy and blood circulation in the affecting area, promoting energy and blood flow after you already relieved everything. So it's kind of like, okay, so we took care of everything, and now we're just making sure that it will stay this way. And the kinesiotaping, actually, the idea of kinesiotaping came to me when I was treating a patient which I didn't treat with SCENAR before. I was treating her with other technology, and I was putting the meridian taping on her, the kinesiotaping on her. And here I treated her with SCENAR, and I said, okay, I will see you next time. And she said, what about the tape? And I was thinking, exactly, what about the tape? Why not? So I did SCENAR, and then I did taping. And it worked miracles. She came back like in a few days, 3 days, 4 days, and she said, I never had such a good result after the treatment. And I was thinking, I was doing the kinesiotaping on her before, I didn't do SCENAR before, so what if I will combine these two and I will see what will happen? So what equipment do you need to use these three technologies combined? First of all, you need SCENAR device. It can be any kind of SCENAR device, professional or home device. And you can have electrodes too, different. You can have checkers, you can have gloves, you can have the new silver electrode, and you can have point electrode as well. Whoever has what is going to be beneficial. Also, it's good to have
acupuncture meridian chart, and also meridian stretch charts, which are in this presentation and will be also on the workshop. Some people like to have a big chart on the wall. Some people like to have a model, the plastic or rubber model of a man with acupuncture channels going through. All of them are good if they are really good quality. Need to have involved meridian balance table, and it's also in this presentation, and who will be attending workshop will have it. Kinesiotape and scissors. Scissors are special for kinesiotape because some scissors don't cut it well, and it starts to glue and make little knots, and it's not comfortable to work with. So this is all the electrodes and scanners. This is whatever you already learned on your first sessions, learning about scanner, what image you will be applying, and all the other things. If you forgot, you can always use it. I also like to use the foil VAR frequencies. Spelled VOLL, Dr. Foil, this logo frequencies, which now is the new scanner devices. And it's very useful. Then acupuncture meridian charts, and charts by Yoshito Mokaino. This is a Japanese research team which was doing work with stretch meridians. You don't need to stretch a patient like this necessarily, it's just beauty. But every meridian has a special stretch, and it's easy to understand what you do when you see the other ones. Involved meridian balance table is done by Richard Dunn. He was my teacher for 20 years before he passed. He passed 2 years ago, and he left 6 books on different treatments with energy balance techniques. And I think it's totally genius because sometimes you're working with one meridian and it doesn't work, and now you know how you balance whatever is happening in this meridian with other meridians. And it's all presented here. And I will later, a little bit, it will be other balance channels shows. You don't need to remember now, you actually don't need to remember anything, you can always look. Kinesiotape can be different colors and different sizes. It doesn't really matter. In my office, men prefer black, women prefer pink or blue, and like older people, they like the tan color, the steel color. So it doesn't really matter. The tape is hyperallergic, so anybody can use it without any problems. It doesn't have latex. So people who say, oh, I can do this tape because I'm not good with any kind of tapes, it has latex, I'm allergic, nothing happens. When the patient doesn't feel that they have a tape on. It's totally comfortable, it doesn't make the person feel that something is holding them. It's opposite, it's a support and it's easy movement. And it's effective for 5 days. The removes very easy, you just take it off, wash yourself, done. These are the scissors. And this is some kind of like a carbon scissors, something like special coated, so it's really cut very well. And the protocol is pretty much like scanner protocol. First, you ask a client to point on the area of discomfort. And it can be like right here, doctor, or it can be somewhere in this area. And you also will palpate this area too to see like where is more, where is less, to figure out which channel is this. And sometimes it can be 2-channel involvement, or sometimes even 3-channel involvement.
And according to whatever you find, you already make yourself a small chart which channels you can use. And pretty much it's like, oh my God, it's already 3 channels plus. 4 channels balance each channel, so it's 12 channels. But most of the time, it's the same channels. And you will be using like 2 or maximum 3 channels. Then sometimes you also can have a patient who doesn't have a specific pain in a specific place, but it's more like a general problem, like a nausea, fever, or dizziness. And according to the TCM, you can figure out like what organ might be involved, which channel can be involved, and then you will already palpate. Again, you never just go for a channel without confirming that this is a channel. You can do it also by D5. What we're talking about in 2 days. But you have to make sure that yes, this is a channel which might be giving problems. And the problems you will see later, like for each channel. It can be a little bit more than that, but books exist so you can read about it. Then you will put the client in position which stretches this channel, and you work on the area where you found that something is not right. It can be the muscle problem, it can be muscle which is too tight or too loose, it can be pain, it can be any kind of a problem, so you work on this area first. And you try to balance this area with just the scanner device or electrodes. Then you recheck, how is the problem after I work on it? If the patient says, oh doctor, everything is fine, then you can just go ahead and take the area, and we will talk about how. If the patient says, kind of the same, maybe 10% better, maybe like 20% better maximum, then you already know that it might be some other channel imbalance, and then you check other channels. The ones which you decide to work on, you palpate them, you find the place which is not right, or you look at D5 and see which of the channels which might be balancing channels are involved. You work on them the same way, you put the patient in a stretch position, work on the area, and you can work again like with anything you want to work. And you reassess if it's working or it's not working. If it's working, then you're going to go to the taping. If it's not working, you look for the next channel, which might be balancing channel. So it's just showing you what you do. It's the same thing which I did before. You find the place. If the patient cannot show you the real place, it says it's somewhere around the shoulder, and you can ask him, do the movement, which makes it painful, and according to the movement, you will see which channel might be involved, right? So if it's a channel which is like going up, then the channel is getting blocked. It's going to be yang channels. If it's this direction, will be yin channels, and you will be again touching. Okay, if it's yin channels, I will touch all of them, and I find out which ones. Now, what is yin and what is yang? They were thinking about the person working in the rice field under the sun. And everything which is exposed to the sun, and the sun is yang, it's all yang. When the person is dead, yang is down, yin is up. It's up, then this is yin, yin is white, and dark under the sun, yang. Then you look for, like, if, for example, if something which is not channel related, you can see, okay, what problems the channel can make. For example, if it's dizziness or tinnitus, you will always look if the gallbladder meridian is involved. If it's also alternation of chills and fever, it's the first way the pathogen goes into the body through the gallbladder meridian. Check this. If it's urinary difficulty, it might be liver channel, but it might be kidney channel too. It can be bladder channel too. So you will at least like figure out or with D5, which is a very good resource, or in with that palpation too. Or also auscultation, asking like what kind of presenting the patient has. You can look at the tongue as well, you can check the pulse if you know how.
And then you do the stretch. You work one point if you know the points, and the points will be on the workshop. It's too long to discuss now. Or it will be just Nakatani points, which are also very good for the Meridian. And C-class points work as well. This is general points. That's the ones which you will be measuring with Professor Nakatanov. And that's the ones which are shown. Okay. Which will be showing which Meridian is out. Okay, and you also will keep the regular scanner rules of symmetry and reciprocity. This is you show the Nakatani points, and you can use them when you're stretching patient as well. Okay, this is great stuff. With gloves, you can work the channel, and also you can work the abdomen. All channels go through the abdomen. And a lot of times we are so tense that the abdomen is tense, and there is a lot of tension and energy stagnation in the abdomen. I never found who doesn't have the abdomen points active. And there is a guy who died already. He was a doctor in Katahira, Japan, Naoichi Kutsomi, and he treated all patients through working in their abdomen. Everything, glaucoma patients healed, cancer patients healed. It was like a miracle. And it's all because the abdomen is involved with any kind of meridian disorder. We teach patients how to work on the abdomen. We give them home scanner, a glove, a patch, or two gloves, whatever they want, and they work on themselves. And they have great results. We have also mothers working on kids the same way. Any constipation, any kind of problems in the abdomen, any pains in the abdomen, kids have it a lot, gone. And that's about Alena, and it's about 75% of all clients getting positive results, which is absolutely true. 15% don't like it, and 10% will achieve some result. And this is the guy who invented the stretching protocol. Okay, it's Toshiro Kobayashi. So, you check after you treat it, and you see what's happening. If you have positive results, take. Didn't have positive results, go and recheck. Whatever can be involved, will be involved. And you will take care of this. This is another table of Professor H. Tam and involvement of which one? This one, yeah. So whatever channels involved, you have 3 other or 4 other channels which will balance it with all the channels, and it's made from the bagua. So there are different methods which you do by name, by Chinese clock, by the neighboring Chinese clock, like opposites or neighboring, by the family name, by the husband and wife theory, and all of them are presented here. Also, if you will see on the right bottom corner, you will see the reciprocity rules. And you can fit a face into the hand, into the arm actually. You can fit the body into the face, and you can treat through the head, through the face, through the arm, or through the body. Depends how much space you need. And then you tape. The tape is also done while you are stretching the person. This is for the bladder channel. You don't need to tape the whole channel, you will tape only the part of the channel which is not functioning well. And it can be different types of taping.
Usually with acutely injured muscle areas, you will do the I shape. The Y shape you do for the chronic area of the weak muscles. X shape is for a muscle which has different types of movement depending on what you're doing. One of them is rhomboid. And if you have somebody with a swelling, and for the lymphatic drainage, you can do the fan. This is also going to be discussed in the workshop. And this is just, again, if I'm out of time, I can go through it fast. These are different channels with the different problems. It's definitely going to be something on the channel. Plus, it can be some other things. And goes like it can be headache, it can be fever, often in this case because it's a lung channel. Everybody understands this. And you can look, most of the problems are already put here. So I think that you will get a print of it or whatever will be on exposed on the web. And this is a lung stage. The points also included because on the workshop I will be talking about different points, what they form. Colon channel also has all the different problems. There is a stage for the colon channel. Stomach channel. All the different problems. So, for example, somebody comes with a toothache. You can work on the teeth, yeah. Sure, you can work on the teeth because it's a local area. If everything else is fine, it might help. If it didn't help, then you can go and find a place on the stomach channel. Where would it be? What will be the reciprocal area for the teeth? Anybody can tell me? Don't be shy, acupuncturist. It can be on the foot, right? Because the head is the foot. Right? So always think reciprocity. And stomach channel stage. She's very limber. Some people are not, but you can stretch them wherever you can stretch them. It still will be helpful. For people who don't move, they feel better after stretch. Any kind of musculoskeletal disorders, the best treatment for them is movement. Right? You also will be learning the stretching in the workshop. And just very fast, I will go through just for you to see all different stretches, all different channel patterns, like aphasia. So heart channel, you can do it also on the head for actually line for aphasia. There are two of them, and you can also do the heart channel. We will talk more about emotional problems, and I have some graphs to show before and after, but it's not for now. Now I'm very fast, just showing you what's available for you, and you don't need to know acupuncture now. You can always use scanner or scanner acupuncture pointer electrode to work with all these problems. And it looks like a lot, and it looks like I have to remember it. No, it goes pretty fast, and it works very well too. Yes, so bladder and liver, governing vessel. A lot of problems, by the way, with governing vessel, both men and women. Hemorrhoids, for example, governing vessel problem, not just colon, right? And any kind of menstrual problems can be liver, but it can be also conception vessel. That's why it's conception. Thank you for your attention, and thank you, Vertebra, for inviting me as a speaker.
Спасибо большое.
Вам спасибо.
Спасибо огромное. Ну, несколько комментариев. Значит, вы видите, что каждый врач использует свои методы. Я вас очень прошу не пугаться тех каналов, которые были сегодня показаны. И я так думаю, что Галина не успеет на семинаре все это рассказать, потому что ей будет очень мало времени для этого. Но вы поняли, что Любой метод, он эффективен в руках специалиста. И то, чем вы владеете, в субботу будет вот как это первичная школа работы с каналами с помощью SCENAR.
With the channels, with the help of SCENAR. Don't be scared. There will be elements clear to everybody. Don't think they are careful. Your objective is to learn or not to learn further. It is impossible to teach somebody who doesn't want to learn. We have the last report, but the reporter is unwell. If you have any more strength and energy, then in about 15 minutes, I will tell you the essence of this report, the main idea of this report. Yes or no? Do you want? My dear friends, actually, not to make you think that I'm taking the wrong topic, I want to tell you that I graduated as a pediatrician and worked for 8 years as a children's doctor. There's also Nina Farrugia here, who was the teacher at our university, and she can confirm that. So I'm very happy that we have such a kid. As a rule, both kids and adults have some pains in the chest and the projection of heart, and they usually make people feel uneasy. I can only emphasize that children have those pains only in 20% cases. But basically, the 80% is the pain in the chest, and we have to give first aid without knowing the diagnosis. But further on, we have to make a research and some tests, biochemical, electrocardiological, or subaltrasonic, because little children, children of 5 to 6 years old, they can't tell their complaint. They can't tell you where it hurts and how it hurts. And we have several questions here. Is the pain in the heart always caused by problems, or is just the discomfort in the chest? Do we need any drugs or medicines, or can we use medicines together with SCENAR? It depends on the laws in a particular country. First of all, we have to find out if it's a tarakalgia or cardialgia. In most cases, you can see that cardialgias, real cardialgias, usually happen in 8 to 15% cases. All of you have children, and if they have such kind of pains, you will understand how worried you can feel. Actually, there are very serious diseases which you can see on the slide: myocarditis, pericarditis, cardiomyopathies, different anomalies of the coronary arteries, and defects, heart defects. So you need very high professionalism
to work with those diseases. I will remind you several very important points. It's very important to think of the following components: the perceptual component, emotional affective component, vegetative component, the emotional component, and the cognitive component. When you assess any pain, we need to take these components into consideration, because during the treatment, these components are reduced in different ways. I'd like to emphasize again that we can't risk a child's life. So as a rule, any kind of treatment should be accompanied by medicamentous or medical treatment. I'll tell you a few words about basic illnesses, for example, myocarditis. That's about the heart muscles. Actually, you can diagnose it with methods of palpation and auscultation.
The character of pain by myocarditis, what is important, which is not connected with the motion of the muscles of the chest, of the extremities, which is not treated by nitroglycerin or other medicines. It is not localized behind the chest bone, and doesn't degrade behind the heart sphere. But myocarditis can be mortally dangerous. The next pathology is pericarditis. It is inflammation of the heart leg. It can be viral, like after the influenza or after a trauma, or it can be because of some unknown cause. The character of pain is in the center of the chest bone. It can feel like an attack, but it can be also reflected to the shoulder. It can be spread on the chest, and it can change because of the body position. And let us remember, it is important for SCENAR therapists to have the projection of pain on the skin, but it doesn't mean that we can heal this patient. We need other knowledge and other opportunities. I tell you this not in order to scare you or to say that we are not very competent in this question. I want to underline that medicine is much more difficult than we think of it, all of us together, and me including. Another problem is sportive heart. Now there are very many children who practice sport. Their parents sincerely make their child to be very active in sport. They make children do sport, dance, swim, and very often the child's heart cannot survive this. It's getting hypertrophied, there are pains, and so on. And lately, there are often death cases of young and elder athletes without any previous symptoms. You can hear this all the time on TV. Another problem, hypertrophic cardiomyopathy. It happens when different membranes of the heart can become thicker or thinner without any evident reasons. It causes alteration inside the blood current inside the heart, and it can lead to fainting, syncope. It can lead to loss of consciousness. It also requires at least ultrasound investigation of the heart to find out the reason. It is very important to have diagnosis in this case in order to define the tactics of treatment. Also, there is thorakalgia. It is the state when there is no connection with the heart. It is the reason. Disorders in vegetative system, unsteady neck and collar section. This is disease of stomach or gastrointestinal tract, and we must find precisely why there is pain in the thorax, though children and adults can think that it is connected with heart. What is the purpose of using SCENAR during thoraxalgia? It is important when a patient comes to compassion and to define which diagnosis he has and which further texts of treatment we need. We can deliver passive aid. First, principally, there are SCENAR methods, techniques, which can be applied until the final diagnosis is stated. A small example, which is the most frequent with children, vegetative disorders. Children may complain on that their heart as if stops for some time. They feel that it works in different ways, headaches, hyperventilation. And in this case, we can give first aid, passive aid, by making general techniques with SCENAR. 3 paths, 6 points, and work on the neck and collar zone. The next, myofascial pain syndrome. Today we spoke about it already. The problems in the neck and in the loin. These are the problems of muscles and tendons and bones. And to remove the spasm in the muscles actually will lead to improvement of the state. And only one SCENAR therapy may cause the solution of the problem. We should remember about it. Here we have the points in the picture, which can be used during the disease of interribal muscles. What are the factors foster the development of myofascial pains? First of all, different defects of the chest, which can lead to anomalous things in the skeleton, in the sphere of the chest. It is a wrong position when a person is sitting while studies and work, while a person is working on the computer. Many people who are here during this day already have endalgical position. Some people took the pose in which it doesn't hurt them. It only says that we are forming some defects of the skeleton and muscles. We are looking for different diseases, but we can only learn the child to sit correctly, which is important is to investigate the child, examine him correctly, to palpate the muscles, to find the painful zones or points. You know that it is a so-called trigger points. They can appear with children and adults, and their palpation invokes sharp pain or sometimes symptoms of jump, a very quick motion when we touch this point. For true cardialgia, which is shown here, it is not characteristic. I'm constantly trying to tell you the idea that simply a symptom or a number of symptoms, a syndrome, it can be in different diseases. And in medicine, there is a beautiful definition, differential diagnosis. It is suitable for SCENAR therapy as well. Out of several states, we should find the most known and predictable by us, and then the treatment will be adequate, suitable. It is also the TC syndrome, TC syndrome, when there is pain in the chest, in the joints of the ribs. It is a septic joint juncture and work with the scanner locally on these zones often leads to positive results. It can occur in adults if they sit wrong during driving a car or while sitting at the table, when they feel pain where the ribs are joined to the chest bone. It can also be removed with the SCENAR therapy. Also, it is juvenile osteochondrosis. I'd like to tell you the following thing. The word osteochondrosis in modern scientific idea does not belong to adults. It is the disease of children. We automatically talk about it, that adults have osteochondrosis, but in fact they do not. The special literature is telling us about this. There are dystrophy diseases connected with the age changes, and they lead to some clinical pictures, but this is not osteochondrosis. Neck and chest sections can be destroyed in children, but of course, very often there are pains in the heart or near the heart, which are considered to be cardiological, not thoracological. And it is difficult for a person who is not a specialist to distinguish in these questions. So what is the algorithm of investigation and examination? You see, it is complicated but simple at the same time. That is why in the conditions we can scan our therapist without any additional methods. It is difficult to do it. It is interview, which is always clear. It is connection of pain with the movements of the organism in thorax. When a person is eating, palpation, we can use examination, investigation of trigger zones. We evaluate pain by different scales. It is, which was discussed today, provocative probes. We should ask a patient to cough, to bow down, to breathe in deep, to define the place of pain. It concerns also adults. Of course, it is an instrumental investigation, examination, which is included in all protocols on the earth. Electrocardiogram, ultrasound investigation, Dopplerography, Röntgen, and so on. And of course, consultancy of the neuro specialist, precise specialist, surgeon, orthopedist, neurologist. But don't you think that we are all like the Lord God? We should share our patients with our colleagues. Am I right? And the second stage is the treatment. It can be complex treatment or sometimes immunotherapy, monotherapy, sorry. In SCENAR therapy, monotherapy gives the best results. Thank you very much. I think the reporter will not be offended on me because of such a short report. For today, our scientific program is finished. I'm giving the microphone to our organization committee, and she will tell us the information.